Hello and welcome to National Focus. I am Aliyah Martin. In the headlines, Prime Minister Skerrit declares Dominica open for business, new measures put in place to curb the spread of COVID-19, and reopening of schools postponed due to the COVID-19 spike. Details of the headline stories and more when we return. Welcome back. Prime Minister Honorable Roosevelt Skerrit has declared Dominica open for business and assured his government will not abuse its reach to ensure compliance because of the actions of a few reckless individuals.
My government will not make Peter pay for Paul. We will not lock the innocent in their homes because of the selfishness and recklessness of the guilty. We will not cause those who need to earn a living to go without bread or money to pay rent, simply because a few misguided among us refuse to see the light. We live in an era where working from home is becoming more of the norm than an aberration. Accordingly, we shall encourage employers, even in the public service, to assign as many persons as possible to work from home. I want to say to all of us that Dominica is open for business.
Prime Minister Skerrit advises Dominicans to heed the advice of experts and learn from the millions of deaths worldwide for best practices on how to cope with this pandemic.
If we do not unite to fight COVID, COVID will defeat us. That's my simple message to every Dominican this evening. The doctors have spoken, the epidemiologists have spoken, the academics have spoken, the ill in our hospitals have spoken. And even in some strange way, the millions of persons who have died from COVID around the world have spoken. If tonight some of us are hearing none of these messages, then I appeal to others to take all precautions to avoid those who have sight but would not see.
Dominica is one of few countries worldwide to have endured a minimal number of COVID-19 cases through efficient management and a vigilant society. The Prime Minister warns that while Dominica has managed the spike thus far, Dominica, like many others, is ill-equipped for a major wave of this virus.
The government is doing what it can and what it must to manage the spread of this virus across Dominica. We are supplying vaccines. We have stocked up on supplies. We have adequate accommodation for a reasonable number of persons who may catch the virus, in spite of. But I am warning every single Dominican right now, we do not have the capacity for a major wave of this virus overtaking our country. No island in the region or even the world does. The cases we have now, we are coping with. The number is uncomfortably high, but it is what it is. Whatever caused this current spike is being handled by the professionals.
The nation's leader vowed there would be no legislation to support mandatory vaccinations, but appealed to Dominicans to utilize the opportunity presented to protect themselves and their loved ones.
That I'm not going to Parliament to pass any law to make it mandatory for anybody in this country to take the vaccine. I am not going to instruct the police to stop anyone and inquire whether they have taken the vaccine or not. What I am doing is asking each Dominican to apply simple common sense to what they are doing. But tonight, I do not wish to confuse the issues. I wanted to bring one clear and unambiguous message to each and every one of you. You have your future and the future of your loved ones in your hands. Be careful and be wise. Rely on wisdom and common sense. Let us do all in our power to manage and minimize the spread of COVID in Dominica. We overcame many challenges before, and we can overcome this challenge now. I am confident that we can overcome this challenge, like we have done many times before. Let us unite and contain the spread of COVID in Dominica. Let us use the vaccines that are made available to us.
As of Tuesday, August 24, Dominica stands at 408 active COVID-19 cases with one related death. Due to the recent spike in COVID-19 cases on the island, the Ministry of Education, Human Resource Planning, Vocational Training, and National Excellence has taken a decision to postpone the reopening of schools. The ministry has taken into consideration the anxiety surrounding the start of a new school year during the wave and has spent the last 3 weeks planning a new strategy to approach the upcoming school year. Minister for Education, Human Resource Planning, Vocational Training and National Excellence, Honorable Octavia Alfred says, academic instruction will begin on September 13, 2021 for fifth form students only. These sessions will be conducted fully online.
From September 1 to September 10, 2021, teachers will be engaged in planning and training will be completed in various areas. During this time, parents and the general public will also be engaged. From September 13, 2021 to October 1, 2021, instructions will commence fully online for Form 5 students only. Based on a survey carried out by the Ministry of Education, all students moving from Form 4 to 5 have devices and also have their textbooks. We have a very low number of students who do not have access to internet at home. These students will be accommodated at the primary schools in their villages, taking into considerations the necessary protocols.
Highlighting the structure for these sessions, the Education Minister says students will be given frequent breaks between online sessions to maintain optimal mental and eye health.
To formalize the online learning, students will follow a structured timetable. They will be in class from 8 a.m. to 2 p.m. with 6 45-minute sessions. 2 15-minute eye and brain breaks, and 1 20-minute snack break. Students are expected to be dressed in uniform while attending class, even if they are at home. Classes will be monitored by education officers, principals, and lead teachers.
Students from 1st to 4th form and primary schools will begin their academic instruction on October 4, 2021.
Students from 1st to 4th form will begin instructions from October 4, 2021. Primary school students are expected to also begin instructions on October 4, 2021. The Ministry of Education is in the process of finalizing the model of instruction which will be utilized. This will most likely be a hybrid approach.
Dominica continues to manage the surge of COVID-19 over the last few weeks. New measures approved by Cabinet to curb the spread of COVID-19 as of Tuesday, August 24, 2021, has been gazetted in the Environmental Health Services COVID-19 Regulations SRO 26 of 2021 made by the Minister of Health under the Environmental Health Service Act, Chapter 4201. Shakira Pear reports.
All businesses and establishments will be allowed to open in accordance with the protocols established and published by the Chief Medical Officer with the following exceptions. Restaurants shall be open for takeout and delivery only. Barbershops, spas, and hair salons will be open in accordance with the protocols established by the Chief Medical Officer. These protocols have been published and circulated, and the Ministry of Health will work closely with these businesses to ensure compliance to the protocols. Hot water spas shall be open under the protocols of the Safe in Nature program of the Ministry of Tourism. Businesses will operate from 6 a.m. to 6 p.m. on Mondays to Fridays and 6 a.m. to 1 p.m. on Saturdays. All establishments will remain closed on Sundays. All nightclubs, bars, gaming establishments, and gyms will remain closed. Minister for National Security and Home Affairs, Honorable Raymond Blackmore, says, though the general curfew has been lifted, the new measures put in place will still manage the gathering of citizens. He says the isolation regulation will make provision for the Chief Medical Officer or any doctor authorized by him to isolate or place under surveillance any case or suspected case of COVID-19 or any carrier or suspected carrier or any contact of such persons.
In keeping with these new protocols for home isolation, a medical officer shall require a person who is isolated at home to wear a wristband. The wristband shall be removed by an authorized medical professional when the person is medically cleared. I wish to state under this order, a new person who fails to comply with the requirement to be placed in quarantine or isolation, removed a wristband without authorization, or absconds from the isolation commits an offense. Under the Environmental Health Services Act, failure to comply with measures imposed in connection with isolation or quarantine carries a penalty of up to $10,000.
The wearing of mask is mandatory. A person shall wear a mask or suitable covering over his nose and mouth while using public transportation, in a public building including supermarkets, retail and wholesale establishments, at a market or other similar business or place, in other public places including parks, riverbanks, and beaches.
A person found not wearing a mask in a public place commits an offense. And it's important to note that the fine has been increased from $75 to $500. I also wish to highlight that a business establishment that does not require a person accessing business to wear a mask also commits an offense. Therefore, the onus is not only on the individual, but on the business as well. We're urging all Dominicans to do what is right and to wear a mask to protect yourself and those around you.
The Environmental Health Services Regulations also states that a person shall not host or attend any large gatherings which is defined as 10 or more individuals. All religious places of instruction or worship will be open to allow for no more than 10 persons and to facilitate the conducting of services by electronic or virtual means. Minister Blackmore went on to highlight the other measures falling under large gatherings and restriction on social activity.
Weddings will be limited to 10 persons, which includes 6 persons other than the bride, the bridegroom, official witnesses, and the marriage officer. Funerals will be limited to 10 persons, including the officiant and essential mortuary staff. Anyone attending any sanctioned gathering must maintain physical distance of at least 6 feet from the other persons. All schools shall remain closed and will be reopened virtually on the conditions to be further detailed by the Ministry of Education. A person shall not host or attend 1. A private party which includes any person from outside of the immediate household of the house of occupants. 2. A recreational or competitive sporting event. 3. Any social event. A meeting of a fraternal society, private or social club, or civic association or organization. Anyone attending or hosting such an event commits an offense.
No more than 3 persons shall occupy a row of a bus and more than 2 persons per row in a taxi. Passengers must sanitize hands, wear a mask, and keep windows open as much as possible. The restriction of visitation will remain in place, as a person shall not be permitted to visit any place of quarantine or isolation hospital, infirmary, residential care facility or nursing home, prison, or home where a person infected with COVID-19 is isolated. This is especially important to protect the elderly, the vulnerable, the incarcerated, and the sick. All are encouraged to continue adhering to the protocols put in place by the Ministry of Health to keep Dominica safe and to combat this virus. Citizens are also encouraged to know their status and get tested. For more information on the new measures, vaccination, and COVID testing locations, you can visit our Facebook page at GIS Dominica or the Ministry of Health, Wellness, and New Health Investment.
Thanks, Shakira, for that report. National epidemiologist Dr. Sholadin Ahmed says Dominica now has 408 active COVID-19 cases.
As for 4 p.m. of August 24th, our total number of new cases as of yesterday, August 23rd, 2021, 100. Total active cases as at August 24, 2021, 4 p.m. would be 408 cases. Of these 408, PCR positive cases 11, rapid antigen positive cases 397. Total recovered cases 885. Total COVID associated death 1. Total number of people tested 42,527. Of these 42,527, 23,536 are PCR positive cases, PCR tested, and 18,991 were tested using the rapid antigen test kit.
Dr. Ahmed reiterated the importance of being vaccinated.
I am confident for myself and for my family and for all those who are to vaccinated is that vaccine works. I did not say they are always 100%. I did not say vaccine is a bulletproof, but vaccine works. Vaccine works for reducing the transmission. Vaccine works for reducing the severe disease form of this COVID. So I do appeal to the people, those who are still waiting and thinking to decide what to do with the vaccine. It's time to get vaxxed.
Meantime, nephrologist at the Dominica China Friendship Hospital, Dr. Pearl James, says the recent death of a 39-year-old woman was not COVID-19 related.
The Ministry of Health confirms the passing of a 39-year-old female with pre-existing medical conditions. On August 12, 2021, the patient was admitted to the COVID-19 isolation unit at the Dominica, China Friendship Hospital after being found to be positive on the COVID-19 antigen testing as part of routine widespread testing of all patients seeking medical attention services at the hospital. On Monday, August 23, 2020, the patient passed away from hypovolemic shock secondary to perfused bleeding.
Dr. James explained the guidelines introduced by the World Health Organization, WHO, to determine a COVID-19 related death.
With the goal of explicitly and accurately identifying deaths related to COVID-19, the Ministry classifies COVID-19 related deaths in accordance with World Health Organization international guidelines for certification and classification coding of COVID-19 as cause of death. Upon consultation with PAHO, offices in Barbados and Washington, the death cannot be classified as COVID-19 related.
Dr. James extended condolences to the family of her patient.
The government of Dominica and the Ministry of Health, Wellness, and the New Health Investment extend deepest sympathies to her family and loved ones during this difficult time. I also wish to extend my personal condolences, as the deceased was also one of my patients. The ministry urges compassion and empathy at this time and calls on all citizens to respect the family's right to confidentiality and privacy as they mourn the passing of this loved one.
You're watching National Focus. More when we return.
This is CARICOM Secretary General Erwin LaRocque. I took the jab, the COVID-19 vaccine. I'm encouraging you, my brothers and sisters, to join me. Take the jab and observe the protocols. We're saving lives and jobs.
Raise your voices high.
The government of Dominica, through the Ministry of Tourism, International Transport and Maritime Initiatives, officially welcomed its first cruise on Tuesday, July 27, 2021, since the reopening of its borders in July 2020. Since then, Dominica has seen the arrival of a number of cruise ships to its shores. Parliamentary Secretary in the Ministry of Tourism, Honorable Shakira Lokatibolit, says the arrival of the ship signals hope for Dominica to receive many more visitors.
We are relieved that after this very difficult and challenging year, and even while we still persevere through these times, this call makes a moment of hope and deep sense that we can once again welcome visitors to experience the nature island.
Honorable Hippolyte commended the stakeholders for their commitment shown during the preparations ahead for the season.
People's livelihoods depend on it. Our stakeholders' success depend on a viable cruise industry. Taxis, tour guides and operators, vendors and hairbraiders rely on the direct injection of income into the economy and into their households. And these stakeholders take this very seriously. In preparation for the cruise, when meetings were called, they were present and voiced their concerns. When training sessions were arranged, they were present to provide valuable insight. And when the vaccination call was made, most of them were ready to take that step towards health and safety for themselves and passengers, as they understood the importance of herd immunity for the sector and for the country.
Honorable Hippolyte called on other stakeholders to get certified in order to benefit from the cruise ship season.
So to the certified stakeholders, I want to say that the ministry is pleased with your progress, understanding, and commitment. And for those who are not yet certified, I strongly encourage you to take the necessary steps for your benefit and that of the sector. This is the only way that we will truly be in a position to take full advantage of the direct benefits from cruise.
Honorable Hippolyte encouraged the stakeholders to continue to practice the safety protocols put in place by the Ministry of Health.
I want to wish all stakeholders the very best for this summer season, and as we get ready for our traditional cruise season later this year. Take all necessary steps to position yourselves. This is the time to get certified, improve your product, packaging, and customer service delivery. We urge all our stakeholders to continue adhering to the protocols, which involves the regular washing of hands and wearing of masks.
As countries around the world continue to fight against the COVID-19 pandemic, the government of Dominica remains committed to protecting all citizens. This as a home isolation program was introduced to assist with mitigating the spread of this virus. Dr. Gilda Nesty Tong is the national coordinator for the home isolation program.
Patients placed on home isolation are given a red armband at the testing site where their positive status is confirmed. All persons who have received antigen positive test results from a testing site will be issued a card indicating that they are antigen positive and the date for armband removal. The card in my hand reflects the antigen positive card of Jane Doe. On this card at each testing site, the date for armband removal is either written at the bottom of the card or at the back of the card.
Dr. Nesty Tong says persons who are discharged from the government facility will also receive a red armband.
Persons discharged from the government quarantine facility in Portsmouth with a red armband and further instructions to quarantine at home will be given a discharge note with similar instructions. This red armband is to be secured and protected during the time period of isolation. As long as an individual remains asymptomatic while in isolation, the isolation period is set for a total of 10 days and the armband is removed on day 11.
The red armband should only be removed by a health professional after a period of home isolation is completed.
Armbands are not to be tampered with and are not to be removed prematurely. The red armband should only be removed by a health professional after the period of home isolation is completed. Persons are not to remove the bands themselves, and in the event that a patient chooses to venture out of home isolation with the band on with the band on, they will be fined.
Dr. Nesty Tong encouraged citizens to practice the safety protocols even after the removal of this handband.
Though isolation is complete, persons are still asked to continue to practice the protocols for proper hand hygiene, mask wearing, and respiratory etiquette. Getting fully vaccinated also cannot be stressed enough, as that is the only way we can stop the development of new variants and the continued spread of this disease. The government of Dominica has made vaccines freely available at all major health centers across the island. Dedicated staff are always present to facilitate the vaccination process. The process is done efficiently and is smoothly executed. We therefore invite all of Dominica to help fight this pandemic and get vaccinated.
Salons and barber shops are now able to fully reopen with strict protocols put in place by the Ministry of Health, Wellness and New Health Investment to ensure the safety of all citizens. During the surge of the new COVID-19 cases, all non-essential businesses were closed down to curb the spread of this virus. Let's hear from Shakira Pear in this report.
Owners and employees of salons and barbershops should wear masks, that is N95 or surgical masks, and face shields must be worn by all employees while performing services. Washable reusable face masks are not recommended for service providers. All customers will be accommodated by appointment only. Also, there must be adequate time between the conclusion of one appointment and the beginning of the next appointment to proper disinfecting practices. No group appointments are permitted. No one should accompany a client to an appointment. No loitering should be permitted on the premises. Limit gatherings in waiting areas prior to following appointments to the extent necessary to promote appropriate social distancing. Hand washing with soap and water for a minimum of 30 seconds will be required by employees between every client service. The hand washing technique should be prominently displayed. Disinfectants used for immersion of tools must be changed daily or sooner if it becomes contaminated. Provide hand sanitizer or alcohol tissues for employees and clients, and wash all linens, towels, drapes, and smocks in hot water. Dry completely and store in an airtight cabinet or container. Disinfect all door handles and other surfaces that are regularly touched by clients and staff with disinfectant wipes. The owner and employee must also clean and disinfect all reusable tools and appliances such as shears, clippers, clipper guards, clippies, rollers, combs, brushes, rolling charts, and any other items used in connection with servicing clients. Store in an airtight, closed container. Clean and disinfect all linen hampers and trash containers, and only use such containers that can be closed and used with liners that can be removed and discarded. Clean and disinfect all the restroom surfaces, including floors, sinks, and toilet bowls. Check to make sure all products such as lotions, creams, waxes, and scrubs have always been in a closed container. If not, you must discard and replace. Remove and discard all single-use tools. Place trash cans by door. Store paper products in a closed cabinet and provide antibacterial hand soap. Avoiding the exchange of cash can help greatly in preventing the spread of the virus. If this is unavoidable, be sure to wash and sanitize hands well after interaction. The use of credit and debit transactions is preferred. Ensure break rooms are thoroughly cleaned and sanitized and not used for congregating by employees. A logbook of clients should be kept and be readily available for inspection to facilitate contact tracing. Shakira Pear for the Government Information Service.
Thanks, Shakira Pear, for that report. And now your weather update. A high-pressure system is expected to remain dominant across the northern half of the Lesser Antilles, including Dominica, during the next 24 hours, resulting in relatively dry and breezy atmosphere with only isolated showers. Meanwhile, a reduction in moisture levels can be expected across the islands to the south. Another tropical wave can be expected to move across the area by late Thursday. An increase in dust haze concentration will persist across the area during the next 24 hours. People with respiratory sensitivities should take all precautions to avoid complications. Moderate seas are anticipated during the next 24 hours, with waves peaking near 7 feet. And that's all for this edition of National Focus. Be sure to follow GIS Dominica on Facebook, YouTube, as well as on Twitter. You can also drop us an email at gis@dominica.gov.dm. From all of us here on the GIS News Production team, I am Aaliyah Martin. Thanks for watching and stay safe.